Hi, my name is Dr. Stephanie Idjadi. I'm a physical therapist here in the Great Neck location. Today I'm here to speak to you guys about muscle imbalances in the hip. Muscle imbalances are very common in the hip, and a lot of times they're caused by people who sit too long at a desk and don't get enough exercise by stretching their legs and strengthening. People who sit at a desk for a long period of time, they typically get very tight hip flexors, which run in the front of the hip right here, and hip rotators, which are the small hip muscles that are behind and to the side of the hip, and also their glute max and glute med muscles back here weaken. That causes muscle imbalances, which throw off gait, it throws off balance, it throws off spinal stability. So it's very important to strengthen and stretch the proper muscles. If you are walking and you don't have proper hip extension, that destabilizes the hip, because when you're walking you typically need 15 degrees of extension in the hip, which is about that much. So if you're not getting that from the hip, you're typically compensating and extending more at the back, at the lower spine. And that causes pain and destabilization in the spine. And people who typically don't have the mobility in their hip, they get earlier disc degeneration in their lumbar spine. So I'm here today to discuss a few exercises that you could do at home. But I do recommend, if you feel tight in your legs, you do come to physical therapy, because everyone is different. Everyone has different strengths and weaknesses. And at physical therapy, we could take a look at you and pinpoint exactly what you need to work on. But today, I'm going to tell you generally what people come in with and what they should work on. So a lot of times, if you're sitting at a desk, you get tight hip flexors and tight hamstrings. So what I have my patients do is first they stretch out the hamstrings. So you could get a towel or a band, lay flat on your back in your bed, keep your opposite leg straight, and lift your leg up. Okay? If you are uncomfortable doing it that way, you can bring your knees to 90-90 position and try to strengthen your leg as much as you can. Straighten it out as much as you can. Hold for 30 seconds, repeat 3 times each leg. The next stretch that I like to do with my patients for the tight hip flexors, you again lay on your back. You can put this stretch band behind your leg. Bend this knee, get your back flat on the table, and come over to edge to let your hip drop a little, your leg drop off the table, and bend your knee back. You should feel this stretch right in the front of the leg, in the hip flexor. You could also feel it in the quad muscle. Again, hold for 30 seconds, repeat 3 times each leg. If you're uncomfortable doing it in that position, there's also a modification on a step. We do not have stairs in this room, so I'll show you how you could do it with a table, but I do prefer that you do it with stairs. It's a little safer, especially if you have railing. You are stretching out this hip flexor. You're going to put your foot on a step. Make sure your knee is straight, your toes are pointing forward in this back leg, and lean forward. You should feel it right here. Keeping your heel on the ground, 30-second holds, 3 times each leg. Some other exercises that you could do, again, if you have tightness in your hip, you also have weaknesses. Typically, I see patients have weaknesses in their glute max and also their hip abductor muscles, which are very important for balance and gait. Every time you take a step, you're standing on one foot, and your hip abductor muscle is keeping your pelvis balanced. So I'm going to show you first the exercise for the glute max, the muscle on the back of your hip. So you're going to bend your knees, shoulder width apart, keep them as close as you can to your butt. Lift up, hold 1, 2, 3, 4, 5, and slowly lower it down. Again, up, 1, 2, 3, 4, 5. Slowly lower it down. You could do this for 3 sets of 10. The next exercise that you could do at home, you lay on your side, bend the bottom knee, keep this top leg in line with your spine, and tighten up your knee, bring your toes up, lift your leg up. 3 sets of 10. This is getting the glute medius muscle, which is your hip abductor muscle, and the muscle that stabilizes your leg. So those are a few exercises that you could do at home if you feel like your hips are tight or you have trouble walking or with your balance. Again, I highly recommend that you come see a physical therapist in our office because every patient is different and you may have different needs than another individual. So if you need anything, give us a call, 516-829-0030, and we'll be happy to help.